welcome to the SLPMS or Silverleaf PMS guest speaker series, where we bring you inspiring and insightful conversations with professionals across the healthcare industry. I'm Beverly Johnson. I'm one of the co-owners or co-founders at Silverleaf PMS, and today we're excited to welcome stumbling over my words here, to welcome Stephanie Ligman, or Legman, sorry. And she is a healthcare professional at Behavioral Health Clinic. And thank you for joining us today, and tell us a little bit about yourself.
Absolutely, Beverly. Thanks for having me. I am Stephanie, and I work as an advanced practice social worker at Behavioral Health Clinic in Central Wisconsin. As an APSW, I am currently under supervision and obtaining hours towards getting my full clinical licensure, which here in Wisconsin looks like an LCSW. As an APSW, I work with outpatient mental health therapy part of my work and also work as a psychometrician with our psychological testing team here at BHC.
Okay. For those of that don't know, what is a psychometrician? What do you do exactly?
Absolutely. A psychometrician works very closely with the psychologist throughout the psychological testing process. We administer tests ordered by the psychologist, and we also work to gather data and write up reports to help better inform the diagnostic impression.
Okay. What kind of diagnostic testing or kind of psychological testing do you do? Is it autism type stuff? Just kind of give us a few, hit the highlights. Like you probably do several, but what are the most common ones that you do there?
Yes. At BHC, we offer a plethora of diagnostic assessments. Me specifically, I work with a lot of neurodivergent clients and also personality disorder
Okay.
diagnostic work.
Awesome. And how long have you been there at BHC?
I have been here for just about 9 months, and I primarily serve adults both in my testing realm and also on the therapy side of things.
Okay, awesome. So in the last few years, technology has shown us that, in different systems in healthcare have helped us facilitate our treatment. How has telehealth and any modern systems influenced the way that you deliver care to your patients? Have you seen any changes in the psychological testing side? Or, I know you've been a provider for 4 years now.
Yes, correct. Working in the outpatient setting for 9 months, and I've been in the system of mental health for just about 4 years now,
Yeah.
working with different walks of life in different settings.
Yeah. So you've been in the COVID time, and then after COVID here, how would you say that the systems that you've used have changed since before COVID and now after COVID? How have those impacted the way that you deliver care to patients?
hmm Absolutely. I think one of the huge positives that we're recognizing with telehealth is the increased accessibility. I am
Mhm.
seeing clients who are 2 hours away from me, located in very rural areas of Wisconsin, where they don't have an outpatient mental health clinic located even within 50 miles of their home location. I have people who I see via telehealth who live in the same city that we work, who, because of schedules, transportation logistics, and other things, there's just a lot of barriers to service that I think weren't being recognized pre-COVID. And so telehealth is a great thing in increasing accessibility for those who might not otherwise have access to services.
Yeah.
And all the greatness that telehealth is, I recognize there's a lot of difficulty for providers and even clients to show up authentically and form that genuine connection as we are able to in person. It really keeps providers on their toes. And I think many people are aware of the plethora of research that exists now and how technology really impacts the quality and quantity of human connection, even outside of the therapeutic sense.
Yeah.
And so really providers have had to adapt, build rapport, empower clients in a completely different way, which I think is exciting as a provider to continue to build and conceptualize your skills in that way.
you know, we got thrown into telehealth with COVID. It was kind of a newish thing. And then all of a sudden, boom, telehealth is the way that you see your provider. And I think it just it made providers and patients really flex a lot and get used to that world. And now it's a great thing, especially for, elderly or disabled folks that have, social anxiety type of things, agoraphobia, even, or even people with severe depression that, are doing to even get out of their bed and brush their teeth. The thought of having to get up, get dressed, drive to a place 2 hours away, whatever, and be seen can be overwhelming to the point where just cancel the appointment. If I just have to roll out of my bed, throw some clothes on, and hop on a camera to talk to someone, it's a little less daunting. So you hope that they're going to be more, compliant with treatment, make their appointments. I think a lot of folks have transportation issues, especially if they do live rurally, right? Like trying to have somebody take you 2 hours to a doctor's appointment. It's hard to find somebody to do that. So Yeah, telehealth I think is really helped. Are you able to do any of the psychological testing type of stuff telehealth, or do they have to come into the office to do that?
Mhm. I think it definitely depends client to client. We don't make that impression until the psychologist meets with them, understands the battery of tests that they need to do, and also the barriers client may face and what method of testing might be best for them. We do offer online testing services, and that also kind of ties into wanting to be accessible to the most people that we can. It does look a little different completing assessments and such virtually, but we are able to do some good work via telehealth in the testing realm as well.
I didn't know that you could do psychological testing, via telehealth. I know there's like some screening stuff you could do, right? PHQ-9, GAD-7s, but I didn't know
Mhm.
if you could do the actual psychological testing, via telehealth. So that's pretty cool. Um,
Mhm.
so like systems are the backbone of healthcare. We kind of, I think we talked a little bit about this, about the patient outcomes. Has there been any specific systems or, technology? I've talked to another previous provider about how I tried to use Remarkable as my note-taking thing, because it feels like paper and you're supposed to keep everything all organized. But I ended up going back to paper because it just wasn't something I was comfortable with. Has there been anything like that but maybe in reverse, like, oh, I used to take notes on paper and now I found Remarkable and it's the greatest thing ever? Has there been any software, hardware, any kind of technological type of things that have helped you with and if you haven't any, that's perfectly fine too. But just like I'm always looking for a new tech, new software, new whatever that helps people in their day to day in providing patient care.
I know recently Behavioral Health Clinic has made the switch to IntakeQ for an
Mm-hmm.
EHR. So far, I've had very pleasant experiences with that. It has a lot of really built-in technology, a lot of checks and balances also that BHC has been very thoughtful in setting up and working well with the technology alongside to serve both the providers and the clients to fulfill their needs.
Awesome.
I think I am also a pen and paper type of girl. I will never pull out my laptop during session unless it's absolutely necessary.
Yeah.
Um, and I think it is honestly down to the individual provider. I think in the world of technology, there are many great systems like IntakeQ that are perfect and very assisted to outpatient clinics. And I also think it really individualized from provider to provider. I know providers that don't take any notes during session. I'm like, please give me your memory skills.
I
But
know.
those are the things that I have found to be helpful in my own practice.
That when I used many years ago when I was going through college and waiting tables, there would be waitresses that would go take orders and they don't have anything to write down. I'm like, how do you do that? You got a table of 10 people and you're just memorizing all this? No way, I'd have to have a piece of paper. But it's just kind of funny hearing people's technological stories, right? Like, so we run a big Facebook group and we have all these different providers in there and they're always giving us little tips and tricks. Like somebody told us about Text Expander. I think that's what the name of it is. There's multiple little software systems like that they just store all their little text things in that they can pop in different areas without having to sit there and type everything. And that saves a lot of time, right? So hearing all those little
Mhm.
helpful tips from people, I think sometimes helps other providers. So we just asked that question in case there's any kind of special things that you can tell us
I
about.
was very intentional with my system starting out. As I was a note taker, I would plan in like things I want to follow up, interventions I want to use in all my sessions. And I remember very early on in my career, there was a day when I couldn't get to work a half hour early and prepare for my sessions in the intentional way that I used to. And it was one of the best days of therapies I've had yet to this day. And I think I read somewhere once, and I forget where, so I apologize, I can't quote directly, but the best
Okay.
therapy happens in the unexpected. And so I think in all the ways that these tips and tricks and systems are great, I think part of being a provider and meeting people where they're at is understanding that we can prepare in the best way that we can and still recognize that that could be thrown out the window when our client
Right.
walks in and tell them what's going on for them. So I think typically a very organized and systematic person, and I think I've learned in this field that maybe a little looser end on that is not a bad thing.
And that can make people uncomfortable though, right? Because if you're used to having, I don't know how much anxiety that produced for you that day, but if you're used to having like, oh my gosh, I'm late, I don't have all of my notes in a row, I didn't get to check all my charts beforehand. It was kind of the same thing when became an ER nurse many years ago. But when I first became a nurse, I had my little cards, and I had all my little notes for things and reminders to do and all that. And then after a while, working in the emergency room, you're doing good to show up there, grab a cup of coffee, and just start running, for the day. And all of those like preparations and the control that you thought you were going to have on things just goes out the window. And so then you start to learn how to fly by the seat of your pants and just kind of go with the flow. And like you said, I think sometimes that can be the best way to go about your day. It's just kind of just seeing where it leads you. you know,
Yeah,
have the
yeah.
have the things there to help you, but sometimes it's just going with the flow.
Mm-hmm.
Um, so every professional faces challenges. What would you say some of the biggest hurdles that you've encountered in behavioral health, and how did you overcome those?
I think on a macro scale, the largest hurdle presenting itself around the country is the increased need for mental health services.
Mm-hmm.
Um, whether because stigma is going down, even though it's still prevalent, I think people are much more comfortable reaching out and accessing services. And I think also in a way that many people have increased access to benefits to do that.
Mm-hmm.
On an agency scale, I think that BHC has been aware of this trend and have been very mindful to keep up with the robust needs of the communities that we serve, across Wisconsin. I think even since I've started offering more flexible clinic hours to meet people where they're at, whether that be a working individual or someone learning or caring for children, to also expanding our psychological testing to offer a bigger breadth of assessment batteries and also medication management services. We've really been able to create a continuum of care within the clinic, which I think is a really great thing to be a part of. Um, I think outside of the clinic, something that I recognize still to be a huge challenge and barrier to many people accessing services is that in this country, I believe that we have a very strong inpatient system and a very strong outpatient system. And I recognize that those two realms of service are very different. One is very structured and we have care 24/7, and then we move to outpatient, which looks like maybe services once or twice a week. And so in previously working in inpatient settings and now outpatient, I recognize that for individuals with severe chronic mental illness, those transitions can be really hard. And so
Mm-hmm.
I think if there would be any way to create additional systems and additional services available for that transition, I would really love to see it.
Yeah, I never thought about that, but you're right. There is a big jump. You have IOP in some places, but that's
Mhm.
not all places, right? And it's usually very short-lived too. So being able to branch that or bridge that gap there, I think is a very valid point there to help, especially those chronically, you know, chronic people that have those illnesses that are very strong, like ones that are word I'm trying to find. Um, Bridge the gap with the provider or the patients that have the very difficult diagnoses that will help them make that smoother transition between the two, and giving them lots of skills, like things that they can do at home to help them through crisis or whatever. I think that solidifying that, what do you do once you leave the hospital? Hopefully you can get into IOP, but if you can't, what are you going to do in the interim before you can get in to see your provider? Because sometimes even after you get out of the hospital, you can't see your provider for 7 to 10 days. That's almost 2 weeks before
Mhm.
you've been
Mhm.
dropped from one thing and now you don't. What do you do? How do you cope for that 2 weeks there before you see your inpatient provider? I think it's great there that you have in your clinic all of the different roles that you can facilitate that patient being in one place versus, well, I got to go over here for psychological testing. You got to go over there and see your therapist. You got to go over there to see your med management person. So having it all together in one place, I think, is very beneficial to the patient for sure, especially when you're suffering with mental health issues, right?
Mhm.
If I have a lot of anxiety about going different places or meeting new people, then that's going to be more difficult for me if versus coming into a place that I'm already familiar with. I've already met one person. It's much easier for me to come into the door and see the same people at the front desk. Right now I'm seeing a different person. So yeah, I mean, I don't think people think about that those are some of the challenges and some of the positive things that can come out of having all of those providers in one place. And you got a
Mhm.
life coach there. Like that's great, incorporating life coaching into the mix there.
Mhm.
Pretty cool that you're bringing all of that stuff together. Um,
Mhm.
so I know we talked a little bit about this earlier before we got on camera, but where do you see what you do in your role fitting into the larger picture there in the behavioral health clinic? Is it something that you see growing, that you'll be offering more psychological testing? Where do you see it going in the future?
I think that's a really cool part about being in IT is that you get to play a role in so many of the different systems and realms of service. And you get to do that with great support and the
Mhm.
freedom to be curious and really expand your skill set in that time when you're under supervision. And so I've been incredibly grateful to be able to do that. I think that there are roles that many people play more specifically as fully licensed. And I have been given the space to think about what my role might look like after I graduate from being in IT, and I think that genuinely I would like it to be one that is unique and variable throughout the week. I really enjoy that I get to engage in some therapy earlier in my week and then wrap it up with testing. It really keeps my skill set as far as diagnosis and also being empathetic and meeting people where they're at, sharp in all of those different ways, which I think greatly tie into each other. And so I think that my role will likely continue to be a mix of testing and also therapy.
Awesome. I'm glad you're given that time to do that, kind of hone in on where you think you make the best fit, and that'll help you too personally, right? Like if you're doing something that you really enjoy doing, then that makes it not so difficult to go to work every day. So it's
Mhm.
nice to be able to kind of to put your toes in the water in all those different areas, right? And go, this is where I really want to be. So it's great that they're giving you the opportunity to do that.
Mhm.
So if for those of that are wanting to go into like a position like yours for a career path, or maybe they're already starting into it, do you have any advice that you want to share with them?
Absolutely. I think first and foremost, shadow and network as much as you possibly can. Collaboration and connection within this field are everything, and I don't think many people acknowledge that. Many people have walked the path that you are considering walking and have made it through their own educational and employment journeys. And they are so often willing to be a great resource if you ask. And so seek out those internship opportunities, build up those connections. You never know who you'll interact with in the community moving forward. Even in all the settings that I worked in, I still connect with past peers and coworkers to, share resources and understand where the needs lie in our communities and see how we can better, build a bigger referral system and connect people to the services that they need. Um, and so really rely on your supports and get connected to those who are in the field within your community.
Yeah,
Um,
networking is
on
huge. Yeah,
absolutely. I think on an individual level, it's really important to be mindful of who you are and take care of yourself. This is mindful for everyone, but especially someone going or considering going into the behavioral health field, even if you've already been in it for years. I was posed the question once, if your clients turned into the person you are, would you be proud of them?
oh
And I
wow,
think that
that's
that
very
really hit me
insightful.
deep. Yeah,
Yeah.
yeah, absolutely. Because I think we have a really cool opportunity in this field to walk along our clients' life journey,
Mhm.
and it's important for us to be mindful of the journey that we're on, and how we're embodying wellness, how we're building connections in our own lives, within our homes, within our larger communities, um, and being that example for our clients.
Well, I love that example. And you're right. I mean, I think as caregivers as a whole, whether you're social work, nursing, physicians, whoever on that whole spectrum of taking care of other people, we are the worst at taking care of ourselves. And we put ourselves on the back burner to take care of everybody else, whether that's our patients, our family, our children, our husband, our partners, whatever. And we just, at the end of the day, there's not any time left for us, and we just ignore that and keep going. And I don't really feel like you can give of yourself if there's nothing for you to give, right? So if you're burnout and you're tired and you're just barely making it through the day, then you're not able to give the adequate care, I think, to anybody around you. So taking that time out is so important. And I even talk to my providers that are starting their own practices. I'm like, you have to take time off. You can't work 16-hour days every day. You are going to get burnt out, and you're not going to be a happy camper, and then no one's going to be happy around you because you're going to be miserable. But I think we
Mhm.
get to those spots sometimes without even realizing it, and you're like, all of a sudden, wow, how did I get to be so angry and irritated? And then you start looking back at, I'm not sleeping. I'm trying to do too many things. And I think as women too, we try to do all the things, right? We try to wear the superwoman cape, and we're doing
Mhm.
everything. And then we think that's all
Mhm.
expected of us, and we don't ask for help. And it's very important as you're taking care of other folks, I think, to ask other people to help you. It's okay to do that.
Mhm.
And take off the superwoman cape every once in a while, and take time for yourself. Um,
Mhm.
so we talked about a little bit about systems and stuff. How has Silverleaf, my company, helped you guys there at Behavioral Health Clinic be successful, or supported your role there at the clinic?
I've been able to talk to some individuals who work more intimately with you.
Mhm.
Obviously, I have had limited interactions with Silverleaf beyond this conversation, as an outpatient provider. However, I recognize that it's been able to, better help us strategize what we're doing as a business and how we're also connecting with our communities. I think that marketing and managing the services that we offer and comparing that into the community needs that we're trying to fulfill, connecting us to our communities and better help us understand how to do that really increases our accessibility to services, and offering and connecting with more people, which I think is our ultimate goal. And so
Yeah.
From my limited knowledge on that front, I feel like that is invaluable.
Great. Yeah, you have to market. You have to market your practice to let people know what you do,
Mhm.
who you are, where are you, and that kind of thing. There's a lot of people that have businesses, doesn't even have to be mental health businesses, but just businesses. I think putting up a website and maybe having a business page on Facebook is going to bring people in. Doesn't. You got to really push and get out there because you have competition, and it's like any other business. You have other competitors out there and you want to be the first one that people see when they're looking for your different services. And the only way that to do that is to market, have a successful
Mhm.
marketing plan. I'm going to pivot just a little bit. Tell me about a memorable patient story that has really stuck with you. So we all have those moments where, I think we go through the day to day. We don't always realize how much we impact other people's lives, right? We're just going through the motions and stuff. And then every once in a while, we'll have that kind of the aha moment. You're like, oh, wow, I really did make a difference. Or maybe a patient told you made a difference in the way I saw this or did this or whatever. Do you have any of those stories that you could share with our audience? One or two little stories that you could share?
Mhm. Absolutely. Um, with a full caseload, I feel like I could take up your whole evening in heartwarming
Yeah,
stories. And I also recognize confidentiality and HIPAA are
right.
wonderful things, and
Yeah.
I always tell my clients that's some of the best things about therapy. And so I want to approach this question from a thematic perspective and tell
Sure.
you about a theme and thing that I've been working on with a lot of my different clients and how it may look differently, but I think it's been a huge one for a lot of my clients.
Okay.
So essentially, I think that one thing that I've been working on with a lot of my clients is helping them recognize that they exist not only to please others. Um, I think in talking about self-care and whatnot, and in being mindful of being, serving to others and also not selfish, we want to be somewhere that's healthy on that spectrum, and that spectrum looks different for every single person. But just reminding my clients and help them to recognize that it's okay to prioritize ourselves. And oftentimes that when we do that, it allows us to more authentically serve others and show up for those people who we previously were living to serve.
Mm-hmm.
Um, this presents in my work with mothers who care a lot about their children in any gendered individual who really care about their job and kind of live to work and really see that as a big part of their role. I think expanding my clients' viewpoints and recognizing that we serve more than one role throughout our life.
Mm-hmm.
And one of the big parts of our roles is to make sure that we are well. And that's okay to have that as a priority. It's not selfish. And obviously that looks different for everyone, but I think that's something really fulfilling that I've been able to work on with a lot of different people throughout different stages of their lives.
Mm-hmm. Yeah, that's very, very important. Knowing when to say no, because I
Mhm.
think some of us get so overwhelmed with all the duties that we feel like we need to take on. We touched a little bit about this earlier, but I know as a woman, I mean, I'm a 50-year-old woman, and through my life, there's been times where I'm like, there's not enough of me to go around.
Mhm.
And I was always that person that I couldn't say no. If you need help, okay, I'll help you, and I'll help you, and I'll help you. And then I've helped all these people, but no one's helping me, right? And so
Mhm.
being able to have someone to validate you and say, it's okay for you to do you, and to say no, and to be okay
Mhm.
with not having to help everybody is huge. It will help people. And so then you can see it, right? Then you can see the difference in that person's life when they've actually started implementing those things. And you say, hey, good for you. You got
Mhm.
somebody to help with housework, or you were able to say no to the PTA meeting. You were able to, take more time. You're going to get a massage every week or whatever. Self care is just so important, no matter where you are. I mean, for everybody, you've got to take that time, or it's gonna make your not only your mental health worse, but your physical health, right? The stress and all of that stuff wears you down and then starts affecting your physical health
Mhm.
as well.
Mhm.
So being able to see that, I think, is a great thing. Um,
Absolutely.
so, that's all of the questions that I have for you. Honestly, we went through these pretty quickly. I want to thank you so much for coming and sharing your insights and stuff with us, and your experiences. It's a pleasure having you on the show. Is there any last parting words that you want to tell anybody, share, or anything, or do you feel like we covered everything?
I just want to say again, thank you for having me on the show
Yeah.
and connect with your resources, whether that be professional or personal. We're not meant to live alone and we're meant to thrive in communities. And so, whether you're considering a career in behavioral health or even just looking to live a more robust life, I would say reach out to your supports and recognize that you're never alone.
That's awesome. That's awesome final words. So thank you to
Mhm.
our audience too for joining us. And it's another episode of SLPMS Spotlight series from the field. Be sure to subscribe so you don't miss any more inspiring stories from the healthcare world. So until next time, thank you so much, Stephanie. Take care. Have a great day.
Thanks,
Bye bye.
Beverly.